Hello everybody, welcome back to Physio Field. Today we are going to discuss about the basic topic of axis and plane. It is very simple but it is quite confusing, but although you can learn this topic very easily. Now we are going to start discussion about axis and plane. First of all, what is axis and plane of movement? Before we are going to understand the axis and plane movement is the normal anatomical position of the body. The normal anatomical position of the body is when body is in the position of standing upright, legs together, knee straight, toes pointing toward, arms by the side and palm facing toward. In normal anatomical position, the upright standing and legs are totally straight, toes are pointing forward, both arm by the side and palm was in front facing. This is the normal anatomical position. Now we are going to explain about the axis and plane. The body perform movement through a plane and around an axis. Plane. A plane is an imaginary surface along which a movement takes place. Its mean it is the point of an imaginary surface where movements occur. That is, there are three types of planes: sagittal plane, coronal plane, horizontal plane. What is sagittal plane? Sagittal plane, a vertical plane of a body which divides the body into two symmetrical halves. Sagittal plane is a vertical plane of a body in which the body is divided into two symmetrical arms, either in left and right part. Movement in sagittal plane. The movement which occur in sagittal plane are biceps curl, squats, walking, running, vertical jumping, climbing stairs, dorsiflexion, plantar flexion, flexion, extension, movement in specific joints, shoulder and ankle joint movement, back flip and front flip, horizontal plane. The specific joint movements occur in sagittal planar, shoulder and ankle joint movement. So these type of movements are occurs only in sagittal plane. Now we are going to discuss about horizontal plane. What is horizontal plane? Any horizontal plane of a body which is parallel to the diaphragm. Diaphragm. Diaphragm divides body into thoracic cavity and abdominal cavity. In this horizontal plane, we are going to discuss that you have to easily learn that the horizontal plane is directly parallel to the diaphragm is called, it is also called transverse plane or horizontal plane. Divide the body into superior and inferior part. Body is divided into superior and inferior part. In other word, diaphragm divide body into thoracic cavity and abdominal cavity. As it is, the horizontal plane divide body into superior and inferior part. It is perpendicular to the coronal and sagittal plane. The movement which occur in horizontal plane are supination, pronation, retraction, protection, horizontal abduction and adduction, rotation. This type of movement occur in horizontal plane. Now we are going to discuss about frontal plane. The plane of a body which passes from side to side, a right angle to the sagittal plane is called frontal plane or coronal plane. Divides the body into ventral and dorsal section. So frontal plane divides the body into ventral and dorsal section. Movement in frontal plane are abduction, adduction, radial deviation, ulnar deviation, side flexion of trunk, side flexion of neck, inversion, eversion. These type of movements are occur in frontal plane. The exceptions of movement that is circumduction, it is not included in movement in either plane. No axis, no plane movement. Circumduction is the exception in the case of axis and plane. Horizontal abduction and horizontal adduction. This type of movement occur in horizontal plane. Next, retraction and protection. This type of movement also occur in horizontal plane. Next, dorsiflexion and plantar flexion. This type of movement occur in sagittal plane. Next, lateral flexion of neck or side flexion of neck. This type of movement are occur in frontal plane. Lateral flexion or side flexion of trunk. This type of movement occur in frontal plane. Running occur in sagittal plane. Bicep curl occur in sagittal plane. After the end of this topic, you can easily understand movement in axis and plane. Thank you. Thank you for watching.